Hello, everybody. So I'm going to talk today about a kind of a gross topic. I won't lie. So this is the topic of tonsil stones, and sort of the more medical jargony term for them is called tonsilliths. So tonsil stones, they're not actually stones. What they are pieces of food that get stuck inside of your tonsils. So if you ever stop to think about it or look at a tonsil, if you take a tonsil out and cut it down the middle, what you'll actually see is the surface of the tonsil. There's lots of little canyons and clefts in there. And in some people, these little clefts are large enough that you can actually get pieces of food caught in there. So what happens is this food particle will get stuck in that little crevice in the tonsil, and then it basically rots and gets gross in there. So eventually it turns into this sort of mushy, white, yucky smelling stuff. And most of the time it eventually extrudes and comes out, and then you'll notice this sort of gross thing in your mouth that you spit out. Sometimes the stones can actually get caught in the tonsil, and it's not very easy to get them out. But usually people can either cough them out or get a finger back there or a Q-tip or something to get the stones out. The problem with tonsil stones is there's really no way to prevent them. Obviously, all of us need to eat. So as long as you're eating food, it's always a possibility that some of that food will get broken off and caught into the tonsil if you have sort of large clefts and crevices in your tonsil. So usually the way we treat this problem would be to just try and clear out the pieces of food or the tonsil stones when they occur. And for patients where this only happens once every 6 months or a couple of times a year, that's probably fine, and it's not that big of a deal. Where this becomes more of a problem is in patients where this is happening all the time, where literally every day or every other day they're coughing out these gross bits of food. Usually their throat is sore all the time, and it just gets to be more than just a mild nuisance. And in that situation, I do offer patients the option of having their tonsils removed completely. And by doing that, we do definitively fix the problem of tonsil stones. If you don't have tonsils, you can't get tonsil stones. The downside, obviously, is it does require surgery, and the recovery after tonsillectomy is not the most fun, week or two of your life. Typically, I am seeing this problem is usually in adults. I don't really think I've seen any young children, maybe a few teenagers over the years, but it's usually adults. And if you're an adult and you have your tonsils out, it's a pretty painful recovery. So I'd say usually I'm trying to talk people out of this option. But if you're literally having this problem and you're spitting these things out every day and your life is miserable, maybe the operation is worth it. So I hope you learned a little bit about tonsil stones today. It's not the most appetizing topic, I know. But, if it is a problem you're dealing with, come and see me and we'll talk about some options to help you. Have a great day.